Welcome back on this Thursday night. Getting to a hospital, urgent care, or even a grocery store in rural America can mean driving many miles.
And our national investigative team found that without proper access to transportation, people living in these communities have to depend on family and friends.
Investigative TV's Sandra Jones takes a closer look at the issue and solutions to bridge the great health divide.
Surrounded by mountains and massive trees sits the tiny town of Monterey in Highland County, Virginia, a resilient community of about 200 people living in Appalachia. Angelica Levine spent nearly 4 decades here, raising a family. Her husband is deceased, and her children have moved away. At 86, she lives alone and doesn't drive.
Have you ever tried?
Yes, I have tried. Tried and given up.
Why? Why did you give up?
I just couldn't cut it.
For people like Levine, getting to and from their doctor's appointments is a constant challenge. And it's a similar issue in rural areas across the country. Investigate TV analysis shows 1 in 10 Highland County families don't have a vehicle. Across the country, the American Public Transportation Association says 45% of people have no access to mass transit.
Well, whatever I can do can be done here at the medical center, and that's a great advantage because I don't have to drive.
Levine can walk to this medical center, but if she needs to go to the hospital or see a specialist for her glaucoma, that's an hour drive. Highland County launched a transportation service about 8 years ago, providing seniors with another option.
We have a disproportionate number of seniors.
Robert Maupin should know. As senior transportation driver for the Valley Program for Aging Services, he's driven countless miles to help fill a demand here.
We definitely need more than one driver, and we do have a few individuals who volunteer, but most of them don't live here full time.
Maupin typically makes multiple trips 5 days a week from Highland County to the nearest cities where residents have access to additional stores and doctor's offices, like in Stanton and Harrisonburg. The cost to seniors, $10 for a round-trip ticket. We did a comparison on how much it would cost to go to the nearest urgent care in some of the rural communities that don't have public transportation. We looked at Highland County, Virginia. The average cost of gas for a 55-minute drive to the closest urgent care is a little over $6 round trip, and Uber or Lyft is roughly $60 for that same trip. In Issaquena County, Mississippi, a 2-hour and 8-minute car ride to a nearby clinic is about $20 in gas round trip. Nearly $200 for an Uber or Lyft. But there's a huge difference in a city like Cincinnati, Ohio, which has public transportation, and using a random address with an 8-minute round trip to an urgent care is 37 cents in gas by car and $12 for an Uber or Lyft. According to the federal government, the Department of Transportation only allocates about 11% of grant funding to rural areas. The Appalachian Regional Commission has been a driving force to help fund a 4-lane highway system in that region, but the project is still underway. Back in Highland County,
You just get to know the seniors, and they're so appreciative.
Helping those who can't always help themselves.
The older I get, I will need more transportation, and I don't want to exhaust my friends too soon. Really.
Sandra Jones, Valley News Live.
Now in the Appalachian and Delta regions, only 18% of counties have transportation from social service organizations for seniors and people with disabilities. Another challenge, they often have limited schedules and don't run on the weekends.
Football season is kicking off for 2 college football teams. Beth is in with those highlights next.